Hopefully soon, everyone who uses the NHS in England will have a single patient record that brings together the important information about your healthcare. But how are records kept now? How can you view them, and what can you do if there are mistakes in them? The main NHS record that you will have is your lifelong GP record, which moves with you if you change practice. This contains a history of all of your immunisations, appointments, test results, diagnoses, referral letters to specialists, and your prescribed medication. You could also have a separate record held at any other NHS service that you have used during your life. This could include hospitals, dentists, community health services, mental health services, or your pharmacy. Partly. So if you have an NHS login and are signed up to the NHS app, you can view your GP records online. You can see a summary of your GP records as long as you are 16 and over. The app will show summaries of consultations you've had with GPs or other staff members. However, it's likely this only goes back to November 2023, when it became mandatory for GP practices to make this available. It will show any medications that have been prescribed by your GP practice, allergies, and your NHS number. It may also show test results and details about upcoming hospital appointments, but this may vary from area to area depending on how NHS services in your area talk to each other. Yes, for GP records, if you don't have access to the NHS app, you can request either a print or a digital copy of your records from your GP practice. At any other primary care services, ask the receptionist or the practice manager. If you want any records from hospitals, community or mental health services, you will most likely need to contact their records department or PALS team and let them know whether you want records from one particular time or all the data they hold on you. No, you don't need to give a reason for wanting to access your records. You have a right under the NHS Constitution. However, if you are trying to find just one piece of information, it may be quicker to let them know this rather than asking for your whole record. Your request usually needs to be put in writing or in a form. There is normally no charge, and you should get your records within a month. Health professionals can stop you from seeing certain information in your records if they believe it may harm you or others, if it may identify someone without their consent, or relates to records of deceased people that relatives have asked to see. This is allowed under data legislation, and in this case, the information is redacted. The NHS Constitution gives you the right to have any factual inaccuracies corrected on your record. Guidance is available from the NHS on how to do this. You can make the request verbally or in writing to the NHS service which holds this particular record. You may need to provide evidence such as your birth certificate or proof of address if it is those details that are incorrect. You can make very limited changes on the NHS app, but at the minute that's limited to your email address and mobile number, and it can take a while for this to synchronise to your GP record. In limited circumstances, they can. There is no obligation to amend something in your record, which is a professional opinion, according to the handbook of the NHS Constitution. If you and your health professional do disagree on the information that is stored in your patient record, you can ask that a statement is added to make it clear that you dispute it. If you are unhappy about their response to your request to change information in your patient record, you can make a formal complaint using the NHS complaints process. Unfortunately, no, not at the moment. There is still a lot of room for improvement on this. The government wants to create a single record for every NHS patient, and more details are expected to come out on this in the upcoming 10-year plan. Health and care professionals and the wider NHS must follow data protection laws on collecting, processing and storing your personal information to ensure that it is correct, used only for legal purposes, kept confidential and safe. There are some exceptions to confidentiality, including in safeguarding issues, for example in sharing information about the current or potential abuse of a child with local safeguarding teams. Want to learn more about your medical records? Visit our website for more information.